This video is intended to serve as a demonstration of the proper donning and doffing procedures to be used by Boston MedFlight clinical crews when utilizing personal protective equipment in the caring of patients with suspected or confirmed highly infectious conditions. For complete details relating to these transports, please see the appropriate protocols. Detailed checklists have been created to guide you through the application and removal of the PPE ensemble. Strict compliance to these procedures ensures integrity in the PPE ensemble once it has been donned and limits the risk of contamination while being doffed. A trained observer, generally the EMT, will be present to not only read the checklist in real time, but also function as your second set of eyes as you don and doff. Each step should be completed slowly, carefully, and with attention to detail. Allow the trained observer to read each instruction fully before proceeding. Have the trained observer, generally the EMT, present to be your second set of eyes as you don your PPE and to read each step prior to performing. Change into scrubs and remove all personal items such as mobile phone, rings, necklace, bracelets, etc. Inspect all PPE equipment to ensure it is not compromised before putting it on. Put on cloth boot covers. Put on rubber boot covers over cloth ones. Perform hand hygiene using hand sanitizer. Then put on inner gloves. Put on coverall suit, zipping up suit, followed by securing zipper seal tape. Put on outer gloves. Make sure the outer gloves go over the sleeve. Put on an N95 mask. Place disposable hood on over the N95 mask. Put on face shield, securing over disposable hood. Have the trained observer verify the integrity of your PPE ensemble. Disinfect outer gloves prior to entering patient room. A trained observer will guide you through the removal of your personal protective equipment by reading each step prior to you performing it. This trained observer will also prepare the area by laying down a doffing pad, which has markings indicating clean and dirty areas. For this illustration, please see the example diagram attached to the protocol. In addition, the observer will also have placed a biohazard container, multiple sets of clean gloves, and a generous amount of disinfecting wipes on the doffing pad in reach of the person doffing. A folding chair will also be placed near the corner of the doffing pad. Step onto the doffing pad, remaining on the dirty half of the pad closest to you. Inspect your personal protective equipment for visible contamination, such as blood or bodily fluids, or tears before the removal of any PPE. If you discover visible contamination in this inspection, or if a tear is visible, thoroughly wipe this area or tear and allow the surface to remain wet for 2 minutes prior to proceeding to the next step. Disinfect your outer gloves with disinfecting wipes. Allow them to dry and remove them, dropping them into the biohazard container. Inspect and disinfect your inner gloves and allow them to dry. Remove your face shield by pulling the rear strap over your head, allowing the face shield to fall forward and drop into the biohazard container. Once again, inspect and disinfect your inner gloves and allow them to dry. Remove your disposable hood by pulling from the back and top of the hood, removing over your head and dropping it into the biohazard container in one motion. Inspect and disinfect your inner gloves and allow them to dry. Retrieve a clean pair of outer gloves from the clean part of the doffing pad and put them on. Do not put them over your sleeves. Remove your coverall suit by following these steps. Starting at the bottom of the zipper, pull the zipper tape chest flap slowly away, exposing the zipper as your other hand pulls traction on the suit to stabilize it. After the zipper tape is pulled away, use 2 fingers to unzip the front of the suit downwards, using your other hand to pull traction on the suit to stabilize it. Beginning at the shoulders, pull the suit down from the outside. It is important that you do not touch the inside of your suit just yet. Once the suit is below your waist at the level of your knees, stop and disinfect your outer gloves and remove those gloves. Prior to sitting in the chair, assure that the coverall suit is below your waist and does not touch any part of the chair. Now, from the inside of the suit, carefully remove the suit by pulling it over the boot covers, which will remain on, rolling the outside of the suit onto itself. Again, be careful not to touch the outside of the suit. Once out of the suit, discard it in the biohazard container. Remove your boot covers by following these steps. One at a time, roll each boot cover onto itself as you remove it down and away, ensuring that the external surface is not exposed. Step, 1 foot at a time, onto the clean part of the doffing pad. You may do this while seated by rotating in the chair. Discard the boot covers in the biohazard container. Next, remove the cloth boot covers by rolling it down and away from your boot. Discard them in the biohazard container. Inspect and disinfect your inner gloves and allow them to dry. Remove the N95 respirator by grasping the mask at the nose and pulling straight away from your face, then lifting the mask over and off your head and dropping the mask into the biohazard container. Inspect and disinfect your inner gloves, allow them to dry, and then remove them. Perform hand hygiene and complete a final inspection with the trained observer to ensure that no traces of infection were missed. You should be careful to not step on a dirty area of the doffing pad while departing the doffing area. You may now leave the area wearing scrubs.